Hello. On today's module, we will be discussing health outcome measurements. And there are three learning objectives for today's class. The first is to identify how public health metrics serve as indicators of the health status of the population. And then I'm going to, discuss the three main purposes of measurement in terms of improvement, accountability, and research. And finally, I'm going to describe the donor BPN model. I'm not mentioning this very well, so my apologies. Okay, so with learning objectives one, we'll be talking about the public health matrix. And pretty sure you guys are familiar with these types of services that are provided in healthcare facilities. We have primary prevention, things like vaccination. Then we have secondary prevention, where we're thinking about mammogram, just basically to screen of early detection of diseases, or just to show what one's risk are. And then we have the tertiary prevention. We're kind of managing the disease post diagnosis, things like chemotherapy. So, in terms of having to actually have the services done, providing it, there's some of the things we want to be interested in looking at. First, we want to look at what are the determinants, the things that are causing things like this. For example, early onset of breast cancer, things like the diseases that the vaccination is trying to prevent. And then we also have to deal with the distribution of frequency of which this health events happen. So these are the two things that we are concerned about as healthcare professionals. And to do that, we want to be able to there are a few things you want to know. Who is a population for which we are having this conversation about services, and what healthcare needs do these populations actually have? And then, what are the services that they're available, and whether these services can actually address the needs of the population. And then we need to know what the population's health status is in terms of what is it presently, where do we want it to be, and to be able to understand this part of the population's health status, we will be looking at health indicators or matrices. What the matrices does for us is that we kind of get a sense of what is good and what is bad, and how do we know that bad has been improved to become good by the time we provide services like that. And that is where we have things like measuring mortality rates, incidence rates, prevalence rates. But when we are kind of interested in knowing how have we moved our bad to become good, this is where we're kind of involved in health outcome measurement or health outcome improvement, because we have identified that something is not so good, and we know where it is we want to take it to, and then we get to do a bunch of things in terms of getting to that process. But how do we know that all the things that we have done has actually accomplished what it is that we wanted to accomplish? And this is where we get into the sphere of health outcomes measurement. So, measuring health outcomes. So, one of the things that is really, really important as the population health managers is having to understand that a lot gets done in terms of health. There's a lot of money that goes into programs, intervention programs, and a lot of money goes into research. But sometimes you find that the results that you get in research may not necessarily be the result that you get in clinical practice, because the research can be done in a somewhat controlled environment. Is an environment that clinical practice does not exist in. So even when results have, when we have evidence from research, we still want to think about how do we translate this evidence from research into clinical practice. And those are the reasons why we want to know things like what is the purpose for the measurement that we're doing with the population health, that is in the why, and what is the accountability of the outcomes in terms of what is the how, and how, what do we measure to know that, okay, what we have set out to do has been done, and that is the what. So, with the improvements, we think about things like models of improvement, complementary improvement science tools and stuff like that. But this class is not really going to focus much on this part of the health outcome measurement. We are rather going to kind of talk about the accountability part of it, and this is where you have the donor model that looks at structure, it looks at process, it looks at outcomes. With the structure, we're thinking about what is the context in which care is delivered. Now, you want to know that in order to know how to measure it, in the sense of one context may not be the same as the other context, and so you want to look at things like, okay, when we have this, what when we have an outcome that happens in this context, how does that outcome look in a different context? So we want to take that into account. We also want to be interested in the process, in this, okay, we have the context, but what are the processes from which we go from A to B? I'm going to explain it a little better, but and then with the outcome, we are interested in, okay, what has come out of this, which intuitively when we say outcome. So accountability measures, once solely focused on processes, and that's where we have some process measurements. But we're kind of moving towards the part where we are a lot more focused on outcome measurement, being that for some of the times the results we are getting from the process measurement does not align with the result we get from the outcome measurement. For one thing, being that processes can be quite complex, and processes can also be quite contextual. So there's so many things you need to account for when you're measuring process to be able to tell, okay, how is that for? Because sometimes an outcome result is not because of the processes that are happening within the healthcare system in terms of clinical practice. It may be things like the social determinants of health, for which a clinician doesn't have much control over, because a lot of that relies on the domain of the patient. So you could understand that while process measurement is great, we want to find a way whereby we are connecting the measurements that we are getting with the process with the measurements that we are getting for the outcome, because the outcome is where we are primarily interested in, and that's what we want to understand. And so there's always a need to do more research when it comes to finding a way to understand what is really getting our patients to have a different outcome. A lot of what goes into research could be in terms of validating the measurement tools that are used in such a way that they become a little less focused, rather they can move so much towards context. There are a number of things that we do to kind of validate it, to say when you use this tool to measure it in context A, or you use it to measure it in context B, the context does not make a lot of doesn't sway so much the results that you get, or the results you get from the measurement, in the sense that we want to have tools that can be applicable in different contexts, in different processes, whereby we can say, this is we can have sort of like a comparison between the results that we get out of it, which is where research really goes into, because it's important to understand that. So with the research part, we're looking at differences in treatments, environments, and how they are producing improvements. We're also looking in terms of efficacy, effectiveness. One of the things that really comes into with research is cost effectiveness. You guys may have heard me talk about it over and over in terms of there is limited resources. We don't have an endless supply of money to spend on health. And so it's very, very important that whatever amount of money that is put into health ideally is being effective in terms of what it is that we want to achieve with that. But even at that, we still have, think in terms of comparative effectiveness and cost effectiveness. However, I don't want you guys to, bother so much about this because comparative effectiveness and cost effectiveness are a whole new topic on its own that can take an entire module or course to complete. So, one of the questions that we ask when it comes to outcome measurement, health outcome measurement, is we want to know what are we trying to accomplish, and how do we know that this thing that we have accomplished actually improved what it is that we're trying to improve. And then lastly, we want to know what changes that we need to make that will result in the improvement. Because some of the times, the programs that you implement do not give you the results that you hoped for, or it could just give you a result that is entirely different from what you had anticipated. It still has to be a way of understanding what is going on, and that is where you have the rapid and continuous cycle of plan, do, study, act, because things just doesn't things don't always work out in the way that we want it to, but we still want to understand why it didn't work out and how could we have done it in a different way. So, which takes us into the third learning objective, an overview of the Donabedian module. So, the Donabedian module, like I mentioned, has three aspects of it. You have the structure, you have the process, and then you have the outcome. So, with the structure, we are looking in terms of what's the environment on which care is being delivered. Looking in terms of what is the human resources, organizational policies, what equipment or materials do they really have to be able to carry out the healthcare services that is needed. So basically, it's kind of looking in terms of what is the safety of care. How are we able to safely provide care for the sake of the patients? And then with processes, we are kind of with processes, which is really more about the interaction that is happening between the clinician and the patient. And with this, we are thinking in terms of how is the provider providing the services that needs to be done, and how is the patient receiving the services. Some of the time there's a disconnect in terms of that, what the provider with the service the provider thinks is providing is not the service that the patient believes is she or he or they is receiving. So there's a need to understand all of this. And then finally, we have outcomes. And with the outcomes, we, really looking into the health metrics, but we are also looking in terms of patient functionality, having to be able to live their life. You don't want to have a situation where you make a patient live longer, but that comes at a cost to them being able to have satisfaction about their life, whereby I am living, but in the way that I'm living is not in the way that I want to be in. I want to live. I'm not getting any pleasure from living. I'm not getting any pleasure from my day-to-day activities. So we want to kind of understand that. And of course, thinking in terms of complications that come as a result. So with outcome is basically what happens to the patient. So they are all interrelated in terms of structure. Ask a question of how is care, organize, and that leads us to process, which asks the question of what has been done or what is being done or what how and in terms of that, which then leads us to outcome, which asks the question of what are the results from what is being done, and outcome then feeds into structure, because the result of what is being done can help us to understand, okay, if we change in the way care is organized, is it going to give us a different results? So that is where we end for today's class. Please use the Q&A board if there's any parts of the lecture is not quite clear to you. I have included some readings on the patient reported outcome measurement, which is a very good tool that is used in measuring health outcome. In the assigned reading, there are a couple of different diseases in which the prompts was used for. You could read that to get a much clearer view, perspective of what health outcome measurement is. um, you know so this is where we end for today. To have a lovely day.